Hello, everyone. Today we are here with Dr. Vu Din, a general and cosmetic surgeon. Thank you so much, Dr. Din, for being here with us today, and we are excited to just ask you a couple questions.
Of course, how can I help?
What originally drew you into medicine and what led you into your specialty?
I kind of fell into it. My dad had always kind of decided what to do in our family. We were sitting there after he passed away, and I told my mom that, like, hey, I'm not sure exactly what to do. And she looked over to my uncle, and my uncle said, he should do surgery. And here I am.
Wow. I think like the family is a big part of it. I think we've heard from a lot of different doctors that like sometimes it's really just about what the family wants. I think I can definitely relate to that, and I know a lot of people can relate to that as well. So I think but I think it's great that now you're in it and that you really like it, which is really great. I think that's really a great thing. What does a typical day look like for you in surgery?
Some days are busy, other days are not. I could be working just a couple hours a day or less than an hour a day. But then I could be working 2, 3 days straight without really any time in between to do anything but work.
Do you happen to have do you have 9 to 5 shifts? Do you have overnight shifts? Maybe do you have different types of surgery you do or different
The
types?
way it really works is that once you graduate, you kind of do what you want to do. When you're in residency, you got to do what people want you to do. So that's very important to understand. When I was in residency, I hated surgery. I hated the people there. I hated the people I was working with. I hated the other students, the residents, the attendings, the hospital. But once I was done, I knew that I was going to be able to do whatever I wanted to do. So because of that, for me, I thought of it as like a marathon. Just like a marathon, you can't sprint to it or through it, or else you're never going to make it through.
I think that's really cool. But I guess kind of going off of that, like especially during training, what's like one challenge in medicine that people outside the field don't really see?
Dealing with family, dealing with people you work with, dealing with administration. You think that medicine is just medicine and you're going into the field that you're just trying to help out people. That is very wrong. It's helping people is just a very small part of what you do as a physician.
Mhm. I guess besides helping people, like what is your favorite part about being a physician?
I love my work. I love, going in there, doing what I need to do, getting out, going home. But then I also love doing the right thing. So I think that's kind of like what you need to understand because a lot of people go into the field of medicine thinking that either they're going to make a lot of money, they're going to help out people, they're doing it because of other people are telling them to do. I was just really lucky that I ended up in a profession that I truly enjoy doing, or else life would really suck. I mean, I'll give you an example. My cousin graduated from college. She was making 175, almost $200,000 a year. And that was like 15 years ago. She's a banker. She ended up marrying her sweetheart from college. He's in hedge funds. He was on the cover, he was on the cover of Forbes magazine, 30 under 30, and some of the wealthiest people in the world. So there are a lot of things that you can do other than medicine if you're doing it because someone else is telling you you think that this is going to make you happy. And I get it. When you're in this, you don't know. And unfortunately, at the end of the day, you just have to decide what you want to do. And if you really want to do it, you got to think of it like this is something that you have to put in work every single day until you get done with it. And even afterwards, then you have to make sure you kind of like it because I had friends who went into surgery. they couldn't deal with it. They actually ended up leaving surgery. Tried to convince them to stay, and they said, I just can't deal with it. I can't deal with the hours. I can't deal with the people." And they left the profession entirely. They're very happy where they're at, but that's, again, everybody has the choice to make.
I think it's really important that students hear like all the parts of medicine. Like I don't think it's. I think it's really important that like they know that it's not like all going to be um, always super happy and it's such an easy path because it's really not in real life. I think it's really different to what people perceive it as, and it's can be a very grueling specialty. I mean, grueling profession if you really don't have the passion for it.
One question I would say, do you think you ever come along stress when you're doing surgery?
No, I think that's one of the reasons why I love my job. Again, everybody kind of likes what they do or don't like what they do. Most of the doctors I've ever worked with hate their job. They hate what they do, but I love what I do every single day. And it doesn't feel like work for me.
What advice, like I guess, kind of going off of that, like um, to kind of handle that stress, like what advice would you give to students who are interested in medicine but aren't sure where to start?
I think you have to do kind of the soul searching, see what you enjoy, what you like, what you're willing to put up with, how much time you're putting into it. It's something to really think about. And I didn't get married until I was late. I didn't have kids until I was closer to 40. So just kind of think about that. I mean, some people have kids early on, some people don't.
Yeah, you really have to truly love what you do. Going more for your career, what type of cases do you see on a daily basis?
Well, as a general surgeon, I see the normal lumps and bumps, gallbladders, appendix, hernias, colon cases, cancer cases. So those are the bread and butter of general surgery. Whereas cosmetic, I used to do a lot of breasts, I used to do a lot of body. Now I focus mainly on face, meaning facelifts, stuff like that.
How many years did it take for you in training to see a patient?
Well, I mean, you gotta think of, you gotta go through college, then med school, then residency, internship and residency. That's 5 years.
Yeah.
The least amount of time that you spend in in residency is 3 years. That's for internal medicine, family practice, and maybe a couple other ones. But if you want to specialize in cardiology or ophthalmology, it's a lot more time.
Do you have one case where you still keep in touch with one of the patients, or
The best cases for me are the patients who see me, say, at Costco or I don't know, at some sort of event, and they come up and say like, "Hey, you may not remember me, but you took care of my mom. She nearly died. She's alive now because of you." And I can't truly remember the exact patient, but I remember the incident. And those are the type of patients to me are the most rewarding. It's not about the money that you make at the end of the day, because, if you're really worried about the money you make, this is a wrong profession for you. Because sometimes you see a patient, they don't have insurance, that means you're not making anything. They have bad insurance, like state insurance, you're making very little. They have great insurance, you're making a lot. But at the end of the day, it all evens out. So if you enjoy what you're doing, you don't think about you don't think about the monetary returns on it. You just think about doing the right thing for each and every single patient and getting them through their acute process, and seeing them again, out, not in the medical profession, but like with their family. That is the best part of medicine. All the other stuff doesn't come close.
Yeah, I completely agree. I think um, like the money is like I don't think it's something that it should even be like a part, like a major part of why you choose to do medicine. I think it really comes down to the passion because um, I think the money is something that a lot of people get confused with, but it's something that um, can really kind of cause burnout if you like don't actually have the passion to do medicine, which is something I completely agree with. Thank you so much for doing this with us. That's like about all we have today for you. So thank you so much for answering these questions. We really appreciate it.
Thank you so much, Dr. Din.
No problem. Thanks for having me. Best of luck with you guys.
Yeah, thank you so much.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.